There are a lot of individuals all around the world that take pleasure in eating eggs because they are a readily available food that is also high in nutrients. As a result of the high levels of protein, vitamins, and minerals that they contain, they are a fantastic addition to the diets of the majority of people. On the other hand, those who are plagued with specific diseases or health conditions could discover that it is most helpful to limit their consumption of eggs or even abstain from eating eggs altogether. In this video, we will talk about a few of the diseases and health conditions that one might want to steer clear of in order to improve their overall health. 1. Egg allergies are extremely common, especially among children and adolescents. Egg allergy is a highly prevalent type of allergic reaction. Those who are allergic to eggs may experience a wide range of symptoms, from mild skin reactions to severe anaphylaxis. These symptoms might range from mild to severe. When faced with circumstances such as these, it is of the utmost importance to avoid consuming any and all types of eggs, including those that are used as components in processed foods. 2. A reduction in the amount of eggs consumed, particularly the yolk, may be recommended to individuals who have a history of cardiovascular sickness or who have excessive cholesterol levels. This is especially true for individuals who have a history of cardiovascular disease. Because of the high cholesterol content of egg yolks, they have the potential to contribute to the building of plaque in the arteries, which in turn raises the risk of developing heart disease. Egg yolks are particularly high in cholesterol. 3. Eggs are a fantastic source of protein for diabetics. Nonetheless, regardless of whether or not they contain a healthy amount of protein, they should be consumed in moderation. Eggs are a rich source of protein. The eating of eggs has been linked to an increased risk of developing type 2 diabetes, as indicated by the findings of a number of studies. People who are already at risk for getting the ailment on their own are especially susceptible to this, as it is especially true for them. 4. Gallbladder disease. Consuming foods that are high in cholesterol, such as eggs, can produce symptoms such as stomach pain and discomfort in individuals who have gallbladder disease or who have a history of gallstones. Eggs are an example of a food that is high in cholesterol. In circumstances such as these, it is possible that it would be recommended to limit or altogether abstain from eating eggs. 5. Irritable bowel syndrome, IBS. Eggs have the potential to exacerbate the symptoms of IBS in certain individuals who are previously diagnosed with this ailment. As part of these symptoms, you may have bloating, gas, and diarrhea. It is conceivable that this is due to the fact that eggs contain a significant amount of fat, which presents a challenge for individuals who suffer from irritable bowel syndrome in terms of digestion. 6. Inflammatory bowel disease, IBD, which includes illnesses such as Crohn's disease and ulcerative colitis, may need individuals to exercise caution when it comes to their consumption of eggs. This is because eggs can cause inflammation in the intestines. People who suffer from inflammatory bowel disease, IBD, frequently experience discomfort in their digestive tract as a result of eating eggs. As a result, some individuals may find that they must completely abstain from eating eggs altogether. 7. Renal disease. People who have been diagnosed with renal disease may be given the recommendation to cut back on the number of high-protein meals they consume, which may include eggs. As a result of the additional strain that the protein in eggs may cause to the kidneys, those who already have kidney function that is compromised may face issues as a result of the additional strain that the protein in eggs produces. 8. Pancreatitis. Individuals who suffer from pancreatitis, a condition that is marked by inflammation of the pancreas, should generally avoid eating foods that are high in fat, such as eggs. Pancreatitis is a disorder whereby the pancreas creates inflammation. It is possible for foods that are heavy in fat to bring on symptoms of pancreatitis, and these foods can also make the illness considerably worse. 9. Weight control and management. Eggs, despite the fact that they can be a nutrient-dense component of a diet that is well-balanced, are high in calories and may increase the likelihood of gaining weight if they are consumed in big quantities. Eggs are a good source of protein. It is possible that individuals who are attempting to keep their weight at a healthy level may need to be mindful of the quantity of eggs they consume and select preparations that include fewer calories. There are certain diseases and health conditions for which it may be prudent to avoid or limit the consumption of eggs. Despite the fact that eggs are one of the foods that are highest in nutritional density and are available to a vast number of people, there are certain diseases and conditions that cannot be avoided. For this reason, it is of the utmost importance for individuals who are afflicted with these diseases to work closely with their medical professionals in order to determine the nutritional choices that are the most appropriate for their specific needs. Like share, subscribe and comment.